who are Dr. Ahmed E. Ogwell Ouma, who is the Deputy Director of the CDC based in Addis Ababa. Correct me if I'm wrong, sir. And Mr. Barry Kashambo, who is the Regional Director of ICAO, Eastern and Southern Africa. It's very important to clearly demarcate that. That is one of our senior colleagues also in the UN system, I believe based in Nairobi. The last time I checked, ICAO was in Nairobi. And we also have Dr. Shem Ochodo, who is the global chair of the Kenya Diaspora Association. So I wish to welcome you all to this congregation this afternoon, this morning, depending on where you are. It is morning for me because I'm in New York currently. I work for the UN as a communication advisor. Not too long ago, I was in Addis Ababa. So I was your neighbor off Bole Road, Dr. Ouma, near the Rwanda embassy. But I'm back here. We are all cooped up at home, working from home, as we've been instructed because of the global pandemic. And we are meeting at different times. We are meeting at a time when the world is grappling with a global pandemic. Everybody is hurting, whether it is children, whether it is women, mama boga, or at all levels, at all cadres of life. People don't know what to do with themselves. But we have a panel today that is going to probably thrash out some of the challenges, some of the concerns that have been raised by participants, by various people as they were registering. And by the way, we are also streaming live on Facebook, and we'll be sharing this on YouTube. And for anybody who is interested in the recording, it is available because we have a panel of people who are ready to share information that will even determine how we move forward. And last but not least, let me not forget my young sister, Miss Jibrin Amalkhair. Miss Amalkhair is from Chad, a country I'm very close to. My neighbor here on Roosevelt Island also is from Chad. So we exchange a lot of common stories, talk about what is happening around. So I have learned to cherish that in whatever we do, we also must give a lending here to each one of us. Miss Amalkhair is in charge of the portfolio at the AU, taking care of women and children. So welcome. We have quite a number of people that are streaming in. I can see my old colleague, Barak Moluka and others sending in questions, Boaz Waruku, everybody. But anyway, without much ado, let me go back to our chief guest, who is Dr. Najib Balala, CS Tourism and Wildlife.
Thank you very much, Rosemary. You have elevated me to be a doctor. I am a politician, jack of all trades. I don't know sometimes what I'm doing, but I try to do as much as I can to serve my country, but also better for humanity. But I'm privileged. Dr. Shem Ochodo invited me here. I'm glad I'm meeting with colleagues from around Africa. And definitely, this is an opportunity, despite it is a pandemic that has affected us. I think if we look at it positively, it could be an opportunity. I think this is an opportunity for Africa. Africa should rise again. And because we have a huge continent of about 1.2 billion people, and if we are clever, we can nurture these populations to be a productive population, especially if we have a very young population. Almost 70% of our population are youth. How do we empower youth to make it happen? I think this pandemic has made us rethink. And when we finish the pandemic, we must be a different continent altogether. This is an opportunity rather of a disaster. But we have to capture that opportunity. I believe, and because my background is mainly tourism, I have been a minister of tourism for 10 years, and I've been in government already for the last 15 years. So I've served different portfolios. But when I look at tourism, because this is what my portfolio is all about, I don't think tourism can work in isolation. Tourism must have enablers. And the biggest enablers, that's why tourism in Africa has never grown. I can give you figures quickly. Tourism in Africa is only 3% of the global tourists traveling all over the world. We have 1.4 billion people traveling. We only receive about 71 million people. And 21 million people get employed from this sector. In the whole continent, 50-something countries. Why is it not growing? Why other countries are growing? Why are we having small numbers? One key issue is about security and perception of security. So that is key for our continent. Number two is about infrastructure. We don't have infrastructure not only to allow tourism to come into the continent, but we don't have infrastructure for connectivity among us. I discussed this in my previous webinars, and I said, this is the time of Africa and the African Union in particular to think, how do we invest today for 5 years' time in infrastructure? Imagine if we have a train with no hiccups from Cape Town to Cairo, connecting all these countries. We'll be able to have almost 300 to 400 million people traveling within the continent of Africa. We don't need then people out of Africa. We need people from Africa. Unfortunately, we don't value Africans. We can give visas and ease the regime of visas to others, but not our neighbors next door. That is the challenge we have. So it needs a paradigm shift of the old thinking that we think our neighbor are more dangerous people rather of people from outside the continent. We don't say that we don't need other people from the continent, outside the continent. No, but we have a market that we can capture, which is at home. At least the continent of Africa. We are lucky as Kenya. We are now trying to revive, or we have revived the domestic tourist. But most of the countries in Africa don't have domestic tourism. How do we survive in the next 2 years when tourism is back? I don't think it will be back that easy. And Barry is here, ICAO and IATA, all of them. Without air revival or aviation revival, tourism will not take off. So we need to think about infrastructure. So it's about trains, railway, it's about road network, it's about air connectivity. Why is it expensive to travel to Nigeria, Lagos from Nairobi, and it's cheaper to go to London from Nairobi? Or if I want to go to Timbuktu, I have to go to Paris to come to Timbuktu, which is again a 2-day trip. I need a visa to Paris, I need to get accommodation to, why? Why is it expensive? So it's us Africans to look at ourselves, and it is us Africans overseas to think, how do we come back home to build it? So these are the things that we need to think seriously. And then for me, I think it's time. The whole world is talking about how do we rebuild our nation, rethink how we can survive post-COVID-19. If we can only take 10% of our GDPs, for example, Kenya is $100 billion GDP, we take 10%, $10 billion. And $2 billion we invest into the handouts for survival, and then $8 billion we invest seriously to infrastructure development. And we make sure we actually make those costing of infrastructure development real and not be part of that thievery that everybody thinks about. So these are the things that will build our nation. These are the things that will make us better post-COVID-19. Rather of us saying we have a pandemic, we are surviving, we might be less population after COVID-19 because our people are dying. Already it is perceived that they cannot even trust our COVID-19 negative certificates because we are from Africa. But COVID-19 certificate is issued by CDC and WHO in collaboration. But because it comes from Africa, it cannot be trusted. Why? Why everything from Africa must be negative? Why everything from Africa is not working? While we have the potential, I hope and I wish, and my prayers goes that this is the time Africa needs to reflect and needs to change not only the narrative, but really invest heavily, both in infrastructure, but also in manpower. So apart from infrastructure, I think 3 other issues we need to invest. 1 is education, 2 is health, and 3 is in technology. These are the 3 key things that we cannot do without in the future. Definitely, we have a huge land. And if we use the manpower right, education, if we use technology right, we can be able to feed our own nations. Most of African countries depend on food from outside. Why? Why do we depend food from outside? These are big questions, and all of us have an obligation. Yeah? And governments don't have the answers. And sometimes government are not the right people to give you the answers. It is us as citizens of this continent to come out and say, this is the way we want it done. And thank God we are somehow democratized. And in Kenya, at least, we can't do anything without the will of the people. So yes, I think this is an opportunity where we can all push hard. And when COVID goes, our continent and our economy is totally different from what it was before COVID. So colleagues and ladies and gentlemen, I want to stop there, but I think this is an opportunity. It's not about tourism, and I decided today I'm not discussing about tourism in Kenya, but I think if we invest correctly today, tourism will be an internal business. We will not be worried about travel advisories. Every day we are being issued on, even on a simple demonstrations of a simple demonstration in the streets of Nairobi, it will be called the country is unstable. That is what is being said about us. Imagine Nairobi, imagine other places, yeah, other countries where very little information is known about. What will happen to that information? So I beg Madam Rosemary, thank you very much for inviting me, but this is a challenge of all of us. We need to think today, invest today. In 5 years' time, we'll have a different continent and a different economy. Thank you very much and good afternoon.
Thank you. Thank you so much, CS Najib Balala. You've given us a lot of food for thought. You've given us a very good statements, some of them policy. A number of questions had actually been brought in. I hope we can indulge you. You can give us a few more minutes before you leave. And I'm just going to share with them randomly, and you can take your pick. But I'll also go on the chat room to see some of the questions that are coming in that are being streamed live. Nashukuru sana. One of the things that was mentioned was really in terms of strategies. Yes, you're talking at a time of the pandemic. And sorry if I called you doctor, I may have read on social media, or your social media nayo ina mambo yake. So I almost thought you had gotten honorary, lakini that is coming. I think it's coming with the different hats that you're holding, and we pray for you. One of the things that, we are talking at a time of the pandemic, and I said it's a pandemic that has crippled the world. It's neither you in Kenya, ourselves in New York, or anywhere, whether you're in Australia, New Zealand, or wherever it is. But some of the things that are brought up that are pertinent is that somebody asked if you could talk a little bit about the strategies on the entire COVID-19 value chain in terms of enhancing recovery in the Kenyan level, regional, continental, and global sphere. And this is something that I'll also share with the other panelists. You did mention my dear colleague, senior colleague, Mr. Kashambo, who is with ICAO, and this is really his baby. But I mean, we would also want some little anecdote from you. In fact, as I was chatting with him earlier, alisema kuwa, yes, I was saying that on 12th of August, we had 9 panelists. But he interjected and said, you can be even 20 panelists. Manake, you have a lot of information and very good information to share with us. So that was one of the issues that has been brought up. And in terms of capacity building, you did not want to focus on tourism, but one of the things that has been mentioned is capacity building in our tourism chain to adhere to the new normal, which is now with the pandemic, managing of tourism, and synergies in harvesting and easing the pandemic. And if there are any legal or operational frameworks being given to NGOs or civil society and, by the government. I know that you may have heard about this already somewhere. I think you were featured, there was an article on Forbes that was saying that Kenya is a destination not to be missed by anybody. I hope it really is, but is it? Yes. Over to you.
Thank you very much, Rosemary. I can say that Forbes said the 10 countries or the 9 countries that you should not miss and is safe to travel, Kenya was #1. Because we put all the protocols in place. We got the safe travel stamp from WTTC, the World Tourism and Travel Council. We worked for the safe travel as well with other colleagues all over the world. But we took seriously the measures, mitigating measures to stop the spread of the pandemic. Yes, most of the countries in the continent of Africa depends heavily on tourism. Probably 10% of our GDPs depends on tourism. Although our economies are small and the numbers are small, for example, 10% of the GDP of Kenya is tourism. And the revenue generated is about $1.6 billion and 2 million arrivals into the country. So we have been affected. We have 2.5 million people working in this sector in Kenya. So most of them at the moment are technically at home, apart from since 1st of August, we have opened the economy and tourism is back slowly with the domestic tourism. But yes, we have been hit badly. The unfortunate thing people think about tourism, they think it's about foreigners coming into the country. No, tourism is about people traveling. The more you travel, the more you generate wealth, and you give jobs to people. And that is how you pay your taxes, VAT and others. But also you allow people to hook on the value chain. For example, like now we have most of the bars and the restaurants are closed. So imagine the agricultural sector that supplies restaurants and eateries all over the country suffer. So yes, it's not just about Mzungus or tourists coming into the country. No, it's about the economy. And that's why this time we should look at tourism differently. And for me, we need to look at tourism and aviation as one. Because without aviation, we cannot have tourism. Because if we don't have cheap flights or affordable flights to connect from point A to point B, then we will not have people traveling all over the continent. For example, you have a $50 seat from the UK one way to Marrakesh. How come we don't have a $50 seat from Nairobi to Cape Town? But it will be a $1,000 seat. That will prohibit people from traveling. And that's why we need to look at aviation on a different perspective in the continent of Africa. Probably we need to think about domesticating the taxes of aviation within the continent of Africa, so it brings the cost down. But I don't think it's just about taxes. It's about many more things before taxes. So we need to rethink afresh, how do we want to revive this? But despite all these challenges, the government of Kenya managed to invest into the sector. One, they have allocated 1 billion Kenya shillings to wildlife rangers, people who are in the frontline heroes protecting our wildlife conservation. So 1 billion Kenya shillings for salaries for 3,600 rangers in the country. Then another 1 billion shillings is for supporting the wildlife scouts within the Kenya Wildlife Service. So that's already 2 billion shillings. Then 3 billion shillings has been allocated for people to refurbish their facilities, because most of the products also are old and tired. You remember, Kenya has been a pioneer in tourism. So our products needed refurbishment. That's why we have allocated 3 billion shillings. It's not a lot of money, but it's just the beginning. To refurbish our hotels, particularly the beach hotels, needs a lot of facelift. So that is another investment. And then the government thought across the board, we got discounted on VAT from 16% to 14%. We got discounted on personal tax and corporate tax from 30% to 25%. So there you have then, you make the people have savings of a 5%. 5% is a lot in terms of the small person to get those savings. Then any person who earns 24,000 shillings, below 24,000 shillings is exempted from any taxation. So again, you're supporting the lower cadre of our people in the country. So those are the incentives the government has given. And then definitely, we will need to still open the economy for people to get back their job. So slowly, gradually, and carefully, we are opening the economy so that we don't have a second wave that will be difficult to handle than the first one. Thank you very much, Rosemary.
Yes, Waziri, a couple of questions have come in. Barak Muluka has brought in a question here where he's saying, how do you open up an economy that seems to condone theft by servants in high places in government? And linked to that comes in a question from Balozi Omwenga with a non-profit saying corruption is a stumbling block to the growth of Africa economic front. How do we navigate the deep waters, Waziri?
First of all, let's all agree we cannot condone theft. We must condemn it. And any person, particularly, let's be real and let's be honest. Any person who steals from the sick should be punished thoroughly. And unless the government, for us in Kenya, the government has taken action. The president has said within 21 days, and the days are almost finishing. He needs to see that the investigative agencies have taken their responsibility, and he wants to see people prosecuted. And there'll be no sacred cows. I've worked with President Kenyatta for the last 8 years. There are no sacred cows. You take your own cross, especially when it comes to fighting corruption. You must take your responsibility. If you are found a thief, you must be condemned as well.
Yes, Waziri, one of the issues that has been brought up is that when is Kenya opening up? You know, we still have the curfew, and of course, you also announced earlier on that you're attending a cabinet meeting. Do you have an inkling on where we're going with this? Because like I said from the beginning, people are hurting. People are hurting, they don't know where to look. This is something that is beyond their control. Watafanyaje?
Sorry, Madam Moderator and Waziri. With permission, I know Waziri is meant to leave like in 2 minutes. If you permit, Madam Chair, can I?
Go ahead.
Yes, Waziri, I know you're shortly heading into the flight, but it may be vital to know we changed a little bit of the program to accommodate Waziri's traveling. We were alerted by his office. Today is actually AU Day. The Africa Union was formed on 9th September 1999 in Sirte, Libya. So we today actually celebrating that Africa Day. We had things lined up we wanted to do, but to accommodate Honorable Waziri, we made this little change. But it's helpful for Waziri to know we have Mzee Dr. Chandaria in the house. We have Deputy Presiding Officer of ECOSOC representing Central Africa in the house. And we also have the other two guests that you've already been introduced to, Africa CDC and as well as ICAO. But I wanted just to say before Waziri leaves, because it's critical, the role of Africa's diaspora. And by this, I mean both historical as well as contemporary. The contemporary Africans bring $80 billion into Africa every single year. And of that, $3 billion come into Kenya. And we're planning a major diaspora symposium end of year. And we are working hard towards that. That's going to be on December 8th to 10th. And we hope, Waziri, we can still work together. We must, through you, pass our gratitude to Excellency President. AU heads of states in March, the last meeting in Addis, complimented Kenya for the role in bringing diaspora on board and tasked Kenya government, requested government to host the Diaspora Summit this year. So we're happy to work together on that. But lastly, I must mention that even historical diasporas, the African Americans alone are $3 trillion business that we could latch into. Otherwise, mine, as I hand back over to Madam Chair, on behalf of the Kenya Diaspora Alliance and our partners in this, we can't thank you enough. It was so easy, Waziri, just when I asked, are you available? You didn't even hesitate. So we really appreciate. And over to you, Madam Rosemary. Thanks a lot.
Thank you very much, Daktari. I want to comment, Rosemary, 1 minute. First of all, I want to say that if we know how to nurture the diaspora, I think our economy will boost. We already seen our foreign currencies in Kenya's #1 foreign currency remittances is from the diaspora. Then it is tourism. Then it is other subsectors of the agricultural sector. So, yes, #1 is in the diaspora. But when this money come in, what does it do? This money must come in to do reinvestment. For example, why should we have SGR be financed by China? Why can the diaspora form a company and finance infrastructure in Africa? That can be an opportunity. Why do we pay interest rates to commercial banks? Why don't we pay interest rates to our diaspora as an entity? These can be an opportunities because the remittances are high. But if the diasporas will just be brought into the country and be used and will have no effect into the investment, then we will lose a lot. But this is an opportunity. I'm glad, Dr. Shemo Chodo, for your leadership. And I think the African Union now has recognized the diaspora role. And if we can define that role properly, I think our economies will be boosted because of those foreign currencies being sent into the country. But thank you very much for inviting me. And I beg to leave Rosemary. Asante sana.
Yes. I know, yes, you have to leave. But before you do that, and I know you're headed out, and like Dr. Chodo said, your office had alerted us. We are just very, very thankful. We cannot thank you enough for honoring this invite and for participating in this panel. I think you've set the bar very high, and I look forward to our other colleagues that you may be able to listen in even as you board your plane, so that at least you can give them support through the same login. Like I introduced them earlier, we do have Ms. Jibrin Amalkhair from Chad. So this is really a Pan-African event. We are heavily, invested in that. And Ms. Amalkhair is also associated with the AU in the portfolio of women and children. We also have in the house Dr. Ahmed E. Ogwel Ouma, who is the Deputy Director, CDC, based in Addis Ababa. Mr. Barry Kashambo, who is the Regional Director of ICAO, Eastern and Southern Africa, based in Nairobi. So, Waziri, thank you very much again for honoring us, but we will continue with the program and we will share with your office the recording so that you can listen to what your other colleagues were able to state in your absence. So without...
Madam Chair, as Waziri leaves, his office alerted us, one of his officers will be available for further questions. And if we wish you journey mercies.
Thank you very much. Thank you.
And when he lands to Nairobi, if you get connectivity, you can say bye-bye. Safe journey.
Thank you very much. Thank you.
Thank you, sir.
Asante sana. Yes, and moving on, allow me to, again, reintroduce and also call upon our other panelists who are here. With gender parity and everything, I don't know if we should go ladies first, but I think let me call on Ms. Jibrin. I cannot see her on the screen, but I think she is here, Ms. Jibrin Amalkhair, to give her remarks. Ms. Amalkhair, bienvenue. La parole c'est anglais, s'il te plaît.
Bonjour tout le monde. Les paroles c'est anglais. I will try. Thank you very much. First of all, allow me to thank the organizer of this webinar. That's a wonderful opportunity to discuss on the urgent issue about the COVID-19 in general and the best practices and how to open or reopen the economic space, because we are so struggling today because everybody is just locked down and people don't know what to do. I think that's a very interesting topic. Hello, everyone. I think I would just talk in general, because when we take the situation in different countries, some countries are more affected than some others. When we take the case of Chad, in total, like talking about the COVID-19, we have a total confirmed case of 840 people. We only, that's not a wish at all. No? We have 72 dead and 700 recovered. So I'm just trying to say that the situation is not that bad, but still the lockdown, the general lockdown is affecting everyone. It means that even though there's not much cases, there's not much death, everybody is locked down because this is the instructions at the global level. Now coming to the social and economic activities, you know, the role that the young people and women are doing in the civil societies today it's so important that right now we can really fill the gap. We can feel that nothing is even moving because they are just trapped in this COVID-19. But the good news is they are reorienting their activities into the COVID-19 topic, meaning that since the COVID-19 has arrived, the activities of our social organization, meaning the associations and NGO, etc., have been oriented to raising awareness and helping people in need, especially right now, because we are in a situation where people don't even have how do you call it, route, like a way to come out of their house because it's raining too much, and young people and women are helping building small roads so people can just come out of their houses, etc. I'm talking about the rural areas. The economic organization, meaning the small and medium enterprise, we can just say that everybody was completely stuck because nobody can move. The first problem why nobody can move is because of the quarantine. The second problem is the technology, because when COVID-19 has come, nobody was prepared, especially this small and medium activities, especially those that are working in the informal sector. Nobody was prepared. So COVID has just come like this, and then people stopped working because they cannot go out, they cannot go and take their goods and come and sell. So everybody was stuck. The challenge is, how can these people find a way out, as there's no much access to technology, there's no much how do you call it, like they don't have enough means that allows them to shift from one activity to another one, from one day to another. So we found ourselves, because we are young and we know how young people are trying to survive, we found ourselves in a very complicated situation where we need to help people out by giving them opportunity to shift the activity they are used to do into an activity that is possible for service and goods that are possible to sell through internet, even though we know internet access is the highest the challenge we are facing. So in general, the situation is difficult because of the quarantine. But the way out, as the minister has just said, is when something bad happens, there's always a way out. And the way out is people found a way to live with the COVID-19, found a way to change the activities they are used to do into another activity that is possible into COVID-19. People have learned how to survive into this complicated situation. And at the same time, this is the field situation. But coming back to the advocacy and the government activities, you know, we had some declaration from the government that that's giving aid to social organization, like in franc CFA here in Chad, we can say up to 30 billion franc CFA to the social and economic activities, meaning that they know everybody was trapped. Then we need to have a way out. Some of the creativity and strategy to come out are coming from us, but at the same time, we need some means from the government. We need some support, financial support to come out of the situation. And the financial support that is coming from the government was given to social and economic activities to bring them back. But what I really want to say is that we cannot say it's easy, because it's very, very, very complicated. And I can insist into the technology, because today we are able to make this meeting happen because we have access to technology and we have the opportunity to be here today thanks to technology. And the technology is a complete opportunity that can be offered to young people and women in case something happens, even though nothing happens. That's a very good opportunity to boost their business. And it's difficult because the technology is not accessible for everyone. And I think, as the earlier speaker said, if we need to be able to make it happen, then we need to have access to technology. And I'm talking about the government side. The technology must be accessible. The infrastructure must be accessible. When I talk about ways, you cannot do anything if you cannot come out of your house. You can't do any social or any economic activity because you don't have transport, the first thing. You don't have good route or ways, and you don't have financial support. So today we can say the financial support is coming from the government. The other support are coming from the social organization, because social organizations are helping a lot because they know, they are in the field, they know how people are living, and they are trying to make something happen. I'm really sorry. I wish I could speak in French, but it's fine. Regarding the reform into the reopening of the economic space, we, as social and economic organization, have participated in many meetings with the government and with the Chamber of Trade here in Chad to see if we can have opportunity to open some of the economic activities. In Chad, if we take the example, we have restaurants that are open, we have shops that are open today because of the advocacy coming from the representative of the economic organizations. Because we cannot keep locking down everyone, even though we know COVID-19 still exists. Because the more we lock down people, the more we'll have another social crisis. Because of the lack of education, children cannot go to school. Because the lack of food, the lack of activities. Because most of the people, we know in which life we are living, most of the people are so poor that they live from day to day. So if you cannot go out today or tomorrow, then you don't have the enough means to be able to survive. So right now, I can say the lockdown is half happening because the restaurant and most of the economic activity are opening. The hotels are, of course, locked down. No tourism at all, as you said in Kenya. There's not at all transport, no urban, no rural, nothing at all. That's the biggest challenge, because even buses have been stopped. So people are finding themselves in a very complicated situation, but with the reform and with the financial support of the government and with the advocacy of the different organizations that we are leading, there is a way out, because we are opening small. If the shops are open, the restaurants are open, then even the small activities are opening. But just we are giving the information that they need to respect the barrier measures that we call it here, meaning that they need to keep space from one to another, etc., etc. And in general, we can say that the COVID-19 for Africa, it could be an opportunity, but at the same time, it was a very, very big challenge. It was a very big challenge, because I don't know if that's the first time something like this happened, but I think COVID-19 have brought to our mind that we really need to prepare ourselves. We need to trust what we have. We need to trust ourselves, trust our government, trust our different structure and initiative. When I take the case of Madagascar, when COVID-19 has come, people are dying more of panics than of COVID-19. When I take the example of Chad, we have lost more people just because they are panicking about what the media is saying, the international media and the national media, than the real situation and the illness itself. So the biggest chaos that came in Central Africa in general is coming from the panic, the situation that nobody can master, nobody can understand, something is happening, nobody have the care, and nobody knows who to trust, what to trust. So in general, that's what I have to say. So from the reform, we have the tax exempt for small and medium activities, and that's coming from the government because of the advocacy. And then we also have the opportunity to leave the informal sector to reopen, because they cannot just survive. They have to reopen. But we are putting the measure in place, so everybody will respect the measure and try to put in place its small activity to be able to survive. And then in long term, I think we need to know how to be flexible. We need to understand that COVID-19 could go or could stay, but we need to find a way to survive. We need to find a way to adapt ourselves, adapt our activities, and adapt our small companies and economic activity into this situation to be able to come out. I thank you.
Thank you. Madam Chairman, I hope you are on.
Madam Chairman, you're on mute right now.
Maybe in the absence of Madam Chair, Barry, if you can go ahead before we take questions. Barry, over to you.
I was just saying that I was complimenting Madam. Can you hear me?
Yes, we can now.
Yes, I was just complimenting Madam Jibrin on a very good presentation, and I wanted to introduce the next person, but I think you've gone ahead and done that to our senior colleague at the UN, Mr. Barry Kashambo. Karibu.
Asante sana. Thanks very much. In the interest of time, and thanks very much already for your kind introduction and your recognition. I want to thank the Kenya Diaspora Alliance. Thanks very much for honoring us and inviting us to address these participants who are eagerly waiting to listen to us. I want to start by adding to what Honorable Barara mentioned on the diaspora. I think it's obvious that the COVID-19 has also affected your activities and your members. And we are looking forward to see the impact it is going to have on their contributions. The contribution you mentioned at the beginning, we expect that this year is going to be significantly affected and to be reduced. And that's something that we need to the conversation we need to continue and put on the table. Just to give some statistics about the impact of COVID-19 to the aviation industry. It's interesting to see how the statistics that were given by His Excellency Barara match with the ones in tourism match the ones in aviation. If you look at tourism, we said 3% of the global tourism is in Africa, only 3%. The same percentage applies to aviation. Only 3% does Africa contribute to aviation, to the global aviation, 3%. That's quite low. Aviation is similarly affected by the restrictions and the requirements, visa requirements, lack of liberalization. Those affect tourism and it affects aviation. The other one he talked about was the issue of domestication. Increased domestic tourism is essential for Africa to grow. It's the same for aviation. If aviation is to grow in Africa, domestic aviation must grow. But coming back to the COVID-19, the loss of revenue and impact of COVID-19 to aviation industry or the air transport sector was enormous, or is still enormous. At one point, we only had 5% of the activity going on. 90% of the activity was down. For airports, we anticipated a 61% loss of the revenue. So we will get in about 39% revenue from the anticipated revenue that we had, which was predicted for 2020. Job losses, hundreds of thousands of people are going to lose jobs because of the COVID-19 in the aviation sector. The impact that the low level of travel is going to have on tourism, on trade, and the entire hospitality sector is unbelievable. It's huge. The airlines and airports are facing liquidity problems, and this has implications on the operations. They are not able to pay their loans or debt repayments. They are not able to retain their aircraft leases. They are not able to remunerate their staff. Some of the airlines are actually winding up. Those of you who are following on the news, South African Airways is having problems, facing liquidation. Air Mauritius, Air Namibia, to mention but a few. So we have a big challenge. And yet, aviation is a big factor when it comes to family and friend reunion. That separation has severely affected our people. The loss of funds for prepaid travel that had been already booked for vacation is a big loss to the traveling public. Not to mention one big challenge a hurdle that we have to face, all of us, restoration of the traveling public confidence. Because the biggest sector, the biggest spread avenue for the COVID-19 was through air travel. So the stigma and the fear of air travel is still there. And this is something that we have to fight, something that we have to work on together. So what can be done? As Honorable Barara mentions, says this could be an opportunity and not a disaster. However, it can only be achieved if it is well captured. If you do not capture it properly or harness the potential, it will be disaster. So we must harness the potential. We must grab the opportunity. Otherwise, we are in for a disaster. One, we don't have the funds to support the recovery. Two, we have strong supporting mechanisms when it comes to financing of these sectors, which needs enormous resources. So Africa as a priority must adopt strategic approach to support states and the entire aviation sector to alleviate the severe impact of the COVID-19. That is, the governments must come in. African Union must play its place. It is critical to ensure that there are acceptable levels of safety and security and efficiency. We cannot afford to go below the recommended standards and recommended practices. Jobs must be restored, otherwise we're going to continue to have a problem. There is need to have financial guarantees. All financial institutions require government guarantees to be able to provide loans for recovery. So African Union and individual states must come in place to give guarantees to the air transport sector. So what do we see that could be the cornerstones, indicators that can show us some kind of recovery and reopening of the economic space? One, all of us must work in unison and harness synergies to ensure that we have restored public confidence. That's something that is obvious. Without it, we cannot move. We need to see increased traffic, which can only be achieved through favorable tax regimes. Taxes must be favorable and must be able to allow the recovery and the growth of the sector, not only in air transport, but also in the hospitality and trade industry. We need to see liberalization of air travel, which is going to allow and the increased connectivity within Africa. And this, of course, eventually leads to lower ticket prices. This is very essential. We already have the single African air transport market that was launched. This must be activated. It must be implemented so that Africa is one liberated airspace and we have travel between states. Right now, as we talk, there is almost no connection between East and Western Africa at the moment. You only have to go through Addis Ababa. It's the only way you can go to West Africa from East Africa now. So we need to have this reopened. We have to increase on the interest beyond repatriation, because we are only having repatriation, emergencies, and returning persons. So we need to make sure that we actually advocate, not only that by civil aviation, but also through forums like the Kenya Diaspora Alliance. Advocate for a return of the travel so that we can see interaction and social development coming in through people traveling. As I mentioned, government support is a must, and PPP, the public, private, and government, all of us together must come on board to make sure that we are all playing our part. Honorable Mbarara talked about embracing technology. We must embrace technology. We must develop our infrastructure. And most importantly, Africa needs to think out of the box. We need to think out of the box. We must embrace innovation, without which our programs will not come to pass. And last but not least, we must have a strategic approach in how we want to face the recovery from COVID-19. It shouldn't be a structured approach. It must be strategically done. We must know what we want. We must set our priorities and move and moving it together. Thank you very much. I think with those, I welcome some questions if there are any. Thank you. Your mic is muted, Rosemary.
Yeah. Thank you very much, Mr. Kashambo. For those who are watching, listening, sending in questions, Mr. Barry Kashambo is the Regional Director of ICAO, Eastern and Southern Africa office based in Nairobi. Really, you've given us quite a number of anecdotes, statements that we can actually follow through. But there are a number of questions also that were coming in. And one of the things that I also asked Waziri was the strategies, during this entire COVID time, the value chain to enhance recovery at national level, meaning Kenya, regional, continental, and global sphere. One of the other questions that also came in for you is that what are the challenges to opening up traveling space? I know you guys are in talk with IATA, and like you said, the airlines are hurting. Some of them are even folding up. I have to give a story that when we were attending a meeting, in South America, the only airline really from Africa was the Ethiopian airline. And I think Ethiopian airline, not that I'm holding a brief for them, but they've been everywhere and they never stopped. They've been to the entire world. And even at this particular time, like you say, they're the gateway to West Africa and many, many other places. So a number of questions also came in. There's one that came on the chat here that says, very quickly, let me open it up. It says, travelers have conflicting information, surrounding entry requirements, mixed reports. You get to this airport, you're told this, or, when you get to the airport, or even being allowed in the country. While, of course, Kenya has been featured in the Forbes, but what are the requirements even coming back? I mean, entering Kenya, do they still have the 14-day, the 21-day quarantine? Are there plans from the AU, the UN, or regional blocks to create a central database where information can be accessed and it's up to date, which is verified by all those governments, so that you're not arriving with your family, you're exhausted, and you're told, oh, you needed to have had this certificate or that. It can be very frustrating. So these are just a few of the questions that have come in. Probably you can take a stab at them. Go ahead. Your mic.
Okay, do you want, Shem, can I take the two of them very quickly or take 1 minute?
No, go ahead.
Thank you very much. Now, the first question was about the challenges of reopening. In fact, the two are interconnected. I will answer them together. The biggest challenge of reopening are those in the different restrictions that are in place. I would say there are two categories of challenge of reopening. One are the operators themselves. They are having challenges in financing the restarting because there are so many requirements in terms of the operators as airlines to restart. And secondly, the airports to meet because ICAO has put in guidelines and measures to enable us to safely reopen. And these are costly. So the airports and airlines are having challenges in reopening or financing the reopening and even reorganizing. That's one. Number two, then there are challenges that are, how are you going to operate? How are you going to operate an aircraft with social distancing? How are you going to operate with the stigma that I talked about? How are you going to address the issues of each? At the moment, all the 54 states in Africa have different requirements. They have different protocols, either to do with the acceptance of the medical of the test certificates, or quarantining requirements. All the 54 have different requirements. So how do we move forward? And this is linked to the conflicting information that I think Barack was talking about. The issue here is we need to have harmonized requirements across the continent to be able to travel. We need to be having a regime where we accept each other's the tests that are done. So that if somebody does a test in one state, the results are acceptable in another state. So we need, number three, central data bank, very, very important. We must have a one-stop center where information can be found. And this is being addressed by the African Union. There's a body we call the High-Level Task-force for the recovery of aviation. And we also have a central data bank with the ECA for the United Nations. All these are to facilitate the access to information that can help in resolving this conflicting information. So in a nutshell, it's true, we are having silos, we're operating in silos, and it's important that we have harmonized systems, harmonized requirements, acceptance of measures so that they can talk to each other to facilitate reopening. Thank you.
Yes, some of the questions are actually interconnected, and they were still streaming in. You talked of the database. Dr. Chodo, did you have a comment?
No, Madam Chair, now that you raise it, incidentally, we have, following African internet pioneers, 15 of them that brought internet into Africa 25 years ago. Data mining and big data is a major area, and digital health is one we are looking very keenly into as the new normal. But I think maybe in the interest of time, we can let Pass go on to the next two final speakers. Then we can have a conversation, if the chair permits. Thank you.
Yes, yeah, thank you very much. Allow me to introduce, I did mention, but for the purposes of those who are joining us at this very time, because I can see like we have over 100 people online. Thank you very much for following this webinar. Your support is paramount. Please send out your tweets and tag us, about this webinar. But allow me to introduce Dr. Ahmed Ogwell. He said he had many names, so I'll only use those two. Dr. Ogwell is the Deputy CEO, Africa CDC, based in Addis Ababa. Dr. Ogwell, you're welcome, please.
No, thank you very much, and it's indeed a pleasure. It's a pleasure to be here and to join the Diaspora Alliance to talk about how to open up economies in Africa in the context of COVID. I don't know whether I can be permitted to share my screen. I would like to just go quickly through a few slides to put our discussion in context.
Yes, I think that can happen, and there are a number of questions also targeting you that have come in, quite a number of them related to health and COVID, literally mentioning your name. So people are really looking forward to that. But anyway, go ahead as they put up your presentation.
Yeah, if they can do that or allow me to share my screen, then I can be able to proceed to the next one.
Dr. Ahmed, I have two choices. I can either make you a host and then you'll make me the host back again at the end of your presentation. I guess that would be the fastest, easiest way if you're okay with that.
Maybe can I suggest, Madam Chair, as that happens, we have Dr. Chandaria and Janet and Dr. Ogwell can sort out. Give Dr. Chandaria 5 minutes to share briefs. Probably also with permission, as that's sorted out.
No, as they are doing that, I think they've made him host. Dr. Ogwell, as you're preparing your presentation, let's allow Mzee, this is the interlude, a little bit, just give us a few minutes so that we introduce Mzee Manu Chandaria. As all of you may know or do not know, he's a global leader, he's a philanthropist, he's an entrepreneur. I first had contact with him when really, you may call it a trash fund, but it is very important. He was already talking about sustainable development when we funded it.
I do want
so, Manu Chandaria, go ahead.
Ask a question to each of these panelists. We have reflected on in individual countries, nations.
Dr. Ahmed, are you playing a video? Is that where that sound's coming from?
Are looking at what each other do.
Do you want me to come in or what?
Just hold on. Now we're sorting out some technical thing. Hold him there.
Okay.
Dr. Ahmed, I'm no longer the host. Manu Chandaria, could I ask you to put yourself on mute, please? We're getting a lot of feedback from your location.
I don't know what you want me to do. I got my microphone.
No, hold on,
Given the extended travel.
I don't know.
Go ahead, Dr. Ogwell.
Okay, no, thank you very much. I just wanted to set this in context so that when we are discussing, it's a bit easier to understand and appreciate where we are coming from as Africa CDC in as far as this particular pandemic is concerned. So globally, as of today morning, we have just over 27 million confirmed cases and over 880,000 deaths. And the trend has been that all regions of the world are affected. And this tells us that it is truly a virus that does not respect where you come from and who you were. When we look at the African situation, over the last 2 weeks or so, we have seen a drop of about 15% in as far as new cases are concerned.
Dr. Well, sorry for the interruption. I don't think Ms. Chandari had not heard that I had stopped the two of you. But probably for purposes
of becomes an WTO.
Sorry to interrupt that. I think we have Dr. Manu Chandaria speaking.
It's okay.
If I may just break in for just a second, Dr. Ahmed, if you would kindly sit your cursor on Dr. Chandaria's name, you can mute his background sound.
Do you want me to start?
Yes, go ahead. Go ahead, Doctor.
Thank you. Thank you. I think that the discussion that I've been hearing of various issues and various, number one is first with my very good friend, Honorable Balala. You know, we must recognize in this country, at least in Kenya, 2% of the people really makes what the remaining 98% should have it. And this cannot go on very long. And they're not prepared to change. And this, we will have a long fight until Wananchi people start pushing that what is required and not the 2% sitting at the high tables are deciding the fate of 48 million people. It's not a possibility. So I think that whatever they say, whether he says or anybody else says, I think that it is us as people of Kenya and people of Africa, because I operate in 15 or 16 countries, wherever I've gone, that 1% or 2% really controls everything.
Sorry, Chairman, Dr. Chandaria, there is some noise. Can we mute the other person? It's not Dr. Can we mute Peter, please?
No, I think it was it's Dr. Wells.
Okay, so if it's muted, it's okay. Go ahead, Dr. Chandaria now.
No, there's something going on. If he can either lower the volume and yes, I think that has gone on.
Go ahead, Mzee.
Gone off. Yes.
Can I start again?
No, just continue.
Continue where you left. It doesn't matter.
So my feeling is that even post COVID, unless the people of Africa decides that they want to get somewhere, we'll go somewhere. If we want only 2% to decide for us, we're not going to get anywhere. We're not gone anywhere for the last 50 years, and will not go further if this is going to happen. So I think it's a huge decision that the people of Africa has to make up. Are we prepared to sit together, talk about it, and take action? If we are not, then I think another 10 years and we will continue the same as we are. Because if we have not been able to see the poverty, now the poverty has really gone deep. It used to be 20, 30, 40%, but now in every country, another 20% has been pushed into poverty. At least in Kenya alone, 1.7 million people have lost jobs. You know, they all have their family. They're not going to buy tables. So I think that unless and until we arise and see that we stop this whole question of closures, open it up. Even a country like United States remain open. Because if it can't remain open, then, you know, the daily wages, the people who are the lowest, United States is a different category, but we, 70% of our people depend on daily wages. Now we just can't afford that. So I think that the best thing would be is to see that let our people do not really go blank on the political issues. Let's push our ways by associations, by public meetings, by making very sure that we achieve what we want. And achieving means an opportunity for the people to act rather than 1% or 2% of people sitting in one corner making decision whether I should eat or I should not eat. That's not acceptable anymore. So unless the African population overall decides, then and then we can make change. Otherwise, post-COVID is going to be very, very difficult because there is already a lot of damage has been done socially and economically. More economically because socially it will translate, economic downfall translate into social problems. So it's going to be very difficult. But unless we are prepared to stand up and say, sorry, now time is over, we decide where we want to go. Thank you.
Yes, Chandaria, thank you very, very much. One of the questions that just scrolled on the chat here is that, they really like what you're saying. You have a way of making it very, very brief and direct, but in practical ways. What are some of the things that you're suggesting? I'm just looking at the question that came in. If you can respond to that before we go to Dr. Aguel.
My suggestion is that in every aspect in life today, post-COVID is going to come up with various issues. If people are going to make rules and regulations that either we move right, you can't move. You want to move left, you can't move. You want to go front, you can't move. This kind of attitude has to stop. And I don't know how we are going to explain this because countries in Africa has continued that sovereign mind. Though we are independent, but we still feel that we are sovereign enough that 1% or 2% of the population of a country controls everything. So there's no difference there. So my personal feeling is that we will have to get together to iron out and speak about it as much as possible, not just in small meetings. Openly speak about it that we cannot continue the way we are going. Because post-COVID is going to be very, very difficult. It's a poorer country. Every country in Africa is going to inherit a poverty much more than what they had before COVID. So we have to be very careful about it to find out exactly what are the possibilities and where we should go. To my way of looking, associations, public awareness, discussions, more writings, and talking about the whole issue can probably give us a way and make sure that those 2% does not decide what 48% or what 98% don't live. We need to make little bit of changes in this. And in every country, election keeps on coming, whether 2 years later, maybe 3 years later, maybe 1 year later. At that time, we need to decide. We are selecting people who speaks for the population, not for themselves.
Thank you. Thank you. Yes. Thank you very much, Manu Chandaria. I do remember even in the last webinar, you only said one word, which was just do it. And I think that everybody had it loud and clear. Allow me also then to bring back Dr. Ahmed Aguel, who has put a few slides on the screen. Dr. Aguel, you have the parole.
Madam Chair, we have a request from the audience if Dr. Aguel could go back to the start, if he could rewind the slides a couple of back.
Yes.
Perfect. Thank you.
Yes, he's starting from the top. We had to interrupt her to allow the Manu Chandaria to say a few words of wisdom and guide us. Just do it. That's what he said last time. Dr. Guel, if you are ready, we are ready for you, please.
Yes, indeed, I'm ready, and it's a pleasure, as I said, to be here to speak.
And sorry for that interruption.
Not a problem. We are in the era of webinars, so a lot of things can be able to go wrong. During pen and paper, it was more sure. Yeah, so I wanted to put this in context, because we are talking about COVID and what will happen when we open up, but we need to see what the context is. And I was sharing how the global situation, we have over 27 million cases with over 880,000 deaths, and all regions have been affected. And I wanted to share about Africa. And when you look at the African situation, as of today morning, we have 1.3 million cases with 31,000 deaths. And this tells us the story that we are least affected when we look at all the regions of the world. And in fact, over the last week or so, we are seeing a drop in the number of new cases of about 15%, which is good, but is very mixed. When we unpack that 15% from country to country, it's a very different picture. So when we are looking at averages, it may look like things are slowing down, but when we are looking from country to country, we know that the situation is not the same from country to country. Then I wanted to share the diversity of Africa. That if you look at the African continent, the 55 member states, just 31 of them have less than 5,000 cases. And here it's a very big opportunity for us to be able to bring this pandemic to stop, because the cases are still relatively decent. Most are in between there, and we have only one country that is above 100,000. In fact, South Africa is heading towards 500,000 cases now. But this is to show you the diversity of the African continent in as far as numbers is concerned. Then the testing on the continent is what has been key in showing us where we are in as far as the pandemic is concerned. Sometime in May, we decided to improve the level of testing on the continent. And we gave ourselves a target of 10 million by the end of October. But by the 17th of August, we had hit that target of 10 million. And now we have shifted and we have given ourselves a new target for the end of October. Because if you test, then you get to know your burden. And if you know your burden, then you can be able to prepare even better. A very important timelines for us in Africa. In December, the outbreak was identified in China. 14th of February, the first case was recorded in Egypt. And a week later, the Africa CDC established the Task-force for coronavirus. In fact, it's on this date that African ministers were here in Addis Ababa to provide us with a clear guidance on strategic issues. On 11th of March, WHO announced a pandemic because now very many countries were affected. And a week later, the Bureau of the African Union heads of states, our presidents and prime ministers met to be able to endorse the Africa Joint Continental Strategy on COVID-19. And this gives us the political backing that we need to be able to do what we do. Now, that strategy that was endorsed had two key objectives. One is to coordinate, not just member states, but all other partners on the continent, so that our activities and efforts on the continent are synergized. And second was to promote evidence-based public health practices in our response, whether it is in the way that we do surveillance, we do prevention, we diagnose, we treat. Whatever we do must have a very solid public health evidence base. Now, these two objectives are being implemented through these 6 pillars of the strategy, where we have a surveillance working group, we have an infection prevention and control working group, we have clinical management, laboratory science, risk communication, and supply chain, different technical working groups. They are the ones that are really driving implementation on the continent. It is so important to have these different areas being tackled differently because they require different expertise and experience. Out of the strategy, we have launched the partnership to accelerate COVID-19 testing on the African continent. And this has these 3 T's: we test, we trace, and we treat. Now, some key numbers in as far as this PACT initiative is concerned. One is we wanted to not only increase testing, but we also wanted to know what our burden on the African continent is. And we have a very clear picture right now. We wanted to reach 10 million tests, as I said, but we've surpassed that with 2 months to go. And now the new goal we have set for ourselves is 20 million tests by the end of October. And we are on course to do that. Another of the key activities that we have achieved is we have established an online marketplace for COVID-19 supplies. And here we launched the Africa Medical Supplies Platform, which is a place where member states can be able to go and buy COVID-19 supplies at very negotiated rates, and therefore removing the difficulty of accessing test kits and protective equipment and medication, whatever it is that a country may be able to need. This is a very key achievement because everything is online. Thirdly is vaccine development and access. We know that where we are going, we will need vaccines, and we know that a lot is being done in as far as vaccine development is concerned. And so we did a conference under the leadership of His Excellency the President of the African Union, the President of South Africa, and His Excellency the President, the Chairperson of the African Union Commission, Musa Faki Mohammed. There was a very good attendance, and some key decisions were made during that meeting. One was to put together a consortium for clinical trials. 2 was to ensure that we are ready to access sufficient supplies of a vaccine when it comes. And 3 was to prepare for effective delivery of the vaccine when it arrives. So these 3 areas are the ones that are keeping our strategy for vaccine development and access, our group busy in ensuring that our vaccine strategy is actually going to be successful. Now, shifting quickly, that is the context, shifting quickly to this particular campaign that we have of saving lives, saving economies, and livelihoods in Africa. Some key data: 34 countries still have their borders closed, and only commercial passenger flights are allowed in, which means that travel is still heavily restricted, as Barry and Minister Balala had shared earlier. Screening measures are different from country to country. 14 have made it mandatory for 14 days. 9 countries have made it mandatory testing at border points, and 27 countries require that you must have a negative test before you enter their countries. This means that travel is still quite difficult. When you look at schools, 33 countries have still not yet opened their schools, and it means that this line of social development is still on a pause in the majority of countries on the African continent. So what have we done? We have taken the whole of society approach to try and ensure that we are saving lives, we are saving our economies, and our livelihoods are continuing. And we have 3 broad goals. The first is to protect borders during travel. And we are advocating for a harmonized approach to COVID-19 testing and certification. As Barry had said, we have very many different types of requirements from country to country. And we are engaging with our countries now so that we have this harmonized. That way, if you're traveling, particularly within Africa, it becomes easy. Second is we are working with the private sector and developers to get an e-health network running. Applications on our mobile phones that can be able to be easily verified if the data that you have is actually correct. And finally is we are having a better cross-border information exchange so that travel across borders becomes easier as we open up the economy. Second goal is to protect our economies and our livelihoods. And to do this effectively, we must have good data so that our economic activities are based on evidence and not just what a policymaker somewhere decides. A second is we are enhancing surveillance, particularly in areas that we know travelers are going to be increasing. Our hotels, our tourist sites, our border points. We are increasing and enhancing our surveillance tools and knowledge. And thirdly is we are engaging with the private sector so that not only technologies are being used to generate data, but also we are using that data to start local manufacturing of what we need. The third goal is protecting schools, because schools have to open and some countries have started, but most have not. We need to leverage on surveillance so that we can be able to pick out students who may be exposed and have the virus. That way they don't spread it to others. We need to do a very good risk assessment, particularly at the school level, so that we open when we know the risks are under control. And finally is we need to strengthen our public health measures so that we know that our hospitals are ready to accept and look after any critically ill patients. We know we should be ready that our public health measures are still being respected, wearing masks, washing your hands, social distancing, so that when we are opening, we are not leaving behind public health measures. If we do, we will see a spike in the numbers as other countries like South Korea, Japan, and even China to some extent have seen. We must have our public health measures still being respected. So to ensure that this campaign of saving lives, saving economies and livelihoods was appropriately received, we launched it under the joint platform of Africa CDC, Africa Union, and the World Health Organization. And a few calls to action were actually realized during that launch. The goal, as we said, was to minimize the spread of infections as we open up our borders, as we open up our economies. And we needed to create safe corridor based on public health science, so that travel can be able to be easier. And this we are proposing will be done through very clear registration of COVID testing at border points. That way we remove the fear of fake certificates. We remove the fear of inadequate testing. We are working with the private sector to have a way of confirming some of these tests for those who are traveling to border points. Second is to deploy good, effective cross-border platforms for verifiable testing and information. That way, if someone is saying they got tested in Uganda, for example, and they're crossing into Kenya, there's a way of doing that verification. That will give confidence to people to be able to travel more and do business more, and ensure that all the data that we are receiving is correct. In as far as the economies is concerned, we want to minimize the impact of COVID-19 on livelihoods. And here we are employing digital frameworks for tracking and sharing of information. Secondly is we are supporting the mutual recognition of health information across borders, so that if whatever has been tested in country X will be acceptable in country Y. And we are also strengthening our risk communication so that we can be able to quickly address rumors and misconceptions at source. That way it does not spread to other places. So finally, some key takeaways that we have in our whole of society approach. One is we must build partnerships to expand testing, tracing, and treating to reduce stigma. That way, we have more confidence as we open up this economy. Second is to increase testing across borders so that we get to know the exact burden of disease that we have. Third is we engage communities effectively so that they have more confidence in the data that is coming out. They have more confidence in public health measures. They have more confidence in government interventions. And finally is we must continue to enforce our public health measures as wearing masks, physical distancing, washing of hands, sharing of critical information in appropriate and quick fashion. That way, we are at all times ahead of the curve in as far as COVID-19 is concerned. For more information, you can visit our website where we keep on posting and sharing any new information that we may have. My final message will be that we are going to be with COVID-19 for quite a while. It is not going to be fixed tomorrow. Even when the vaccine comes, it will take a while. So we must look at this as a marathon. It is not a sprint, and we must act knowing that it is our individual action that is going to make a difference. We are the vaccine, and if we become indisciplined, then for sure, COVID-19 is going to spread a lot more than it is now. I thank you.
Thank you. Thank you so much, Dr. Guel, for that impactful presentation and the slides. Really, we were able to follow. I'm sorry for that interruption. Like you said, this is the new normal. We are getting adjusted. We also have in the house the father of ICT in Kenya. When Dr. Chodo was talking in the woods alone for the longest time, preaching about ICT in the schools everywhere, nobody paid attention to it. But here we are now. Everything we do is anytime we wake up, this is the new normal. So thank you very much for that, acknowledgement that it's going to be a marathon, not a sprint, which Kenyans are known for, marathon. So we are very well prepared. But there are a number of questions that came in, and I'm just going to share some of these questions, and you can decide to answer at any given time. One of the things that George Sungu has asked is why is it still costly to do a COVID-19 test for those traveling abroad, while WHO and international philanthropists like Jack Ma have made hefty donations to alleviate the burden for countries like Kenya? And you also touched on the AU. I do remember reading in the media, I think there was a special COVID fund 19 that was set up through the current chairperson at the AU level. How is that going? But more questions are coming in, and one of them was, the other one was, what steps are being taken to promote use of drones to access remote villages, areas for delivery of urgent drugs? Does it make economic sense for countries? This is from Boaz Waruku. Does it make economic sense for countries to rush to reopen economies when COVID-19 cases are spiraling in Kenya? So let me stop here, and I'll give you, yes, you touched on contact tracing. How successful is that being done? It's from Kali Kieti, who is a writer. How successful is contact tracing, and who has been doing it? Back to you, Dr. Guel.
Yeah, no, thank you very much, Rosemary. Let me start with the first question on costs. Donations are a drop in the sea related to need, and donations do not determine the costs of COVID-19 test. These are market driven, and we as Africa CDC, Africa Union, we do not have a lot of influence in as far as getting the cost to come down. Second, around the cost is that this particular test is in demand globally. Every country and territory on the globe has been affected. So when demand is high, costs also tend to go a little bit higher than normal. So costs are going to only come down when we have more companies doing the testing, and when we have the demand probably dropping a bit from where it is right now. The COVID-19 fund was established by the chairperson of the Africa Union Commission on recommendation of the Africa Union Bureau of Heads of State, and that COVID-19 fund is still collecting resources from countries, partners, and even individual citizens on the continent and beyond. And the fund is being used to support the response on the continent. So the fund is there, and it continues to receive resources, and it continues to support our COVID-19 response on the continent. Use of drones, it's very useful. I think Rwanda is leading this quite well, and Ghana to some extent has also introduced drones into their arsenal of COVID-19 response. So drones are a good way of ensuring that you can be able to reach very difficult places in a country. Fourth is, does it make economic sense to open up the economies? Yes, absolutely. It makes a lot of economic sense. Some of the reasons are that Africa's economy is very informal, and the backup for the market selling, the ladies selling in the market is not there. If they don't go out, then they cannot be able to eat. And we have enough information right now of what we need to do in terms of public health measures so that people can be a lot safer. So we can tentatively be able to start putting those in place and then opening up the economies. We cannot be able to shut down forever, and it is important to keep a balance between public health need and opening up of the economies. And we have very clear guidelines that we've shared with countries on how to do that. But it does make sense to open up the economy so long as public health measures are in place and countries are ready to be able to handle any new cases that may be able to come up. How successful has contact tracing been? Very successful. That's part of the reason why we have low numbers on the continent. We started early, we locked down, we did effective contact tracing, meaning we had fewer and fewer people in circulation who had the virus and could be able to spread it. But tied to contact tracing is the need to pass on good information to the public so they know what to do and they know how to do it well. That way you keep as few people as possible being exposed to the virus. Thank you.
Yes, another question from Tandikile Mvundula. This may be early, but she's asking, are any African scientists researching the lower COVID-19 mortality rate on the continent? Yes, you said the numbers were down through contact tracing, but is there any research that is currently going on that people could tap into or you may be aware of in this area?
Yes, we have a lot of research going on.
Just before you respond, let me also give you some accolades here from Dean Ruotomia, who says, thank you, Dr. Ahmed, for such a great and insightful presentation. A quick question. As you state the need to cross-border testing, some countries are charging very high fees, as high as $65 for those who need to be tested, especially truck drivers, citizens within countries like Uganda. What do you think about this initiative and how can it be addressed? Go ahead, Dr.
Thank you very much, it's useful to say again that testing is in the hands of demand dynamics, and from country to country you'll find the tests are different. But what I will say around the testing cost is that we have now introduced antigen testing, which is much cheaper than the traditional testing of the virus itself. And this brings down the costs to as low as $10, $15. And we are encouraging countries to start using this instead of the usual traditional PCR testing that is what is costing a lot more, from $50 to even $100 in some places. So testing costs are really local, and we are working with countries to start doing antigen testing. That way the cost can be able to come down for travelers particularly. Now, on the other question on research, there is a lot of research that is going on on the continent, and we have a whole technical working group under the Africa COVID-19 Task-force that is just dealing with the issues around research. This is coming in from very different angles, from effect of public health measures to surveillance techniques to the vaccine itself, including different treatments that have been shared and those that are being shared, how effective they will be on the continent. So research is going on. And on our website, there is a place for research, but if any individual is interested in it, something very specific, if they drop us mail, we can be able to connect them with a technical working group for this. But research is going on and is expanding as we speak. Thank you.
Yes, thank you. Thank you very much. There are a couple of other questions that just came in as you were speaking. Before we go to, I open it up to everybody else. These are specific to you. This is a tall one. It's from Stephen W. Njoka, who says, Dr. Ouma, do you have any idea on when the world is going to be free of COVID-19, like the way Africa has been recently declared free of polio? Do you think the borders across the continent will open before the end of the year? December is quite a busy time in Africa. Pamela Kibunja says, COVID-19 is a public health issue that needs community responses. How is African CDC ensuring that this is being done? Secondly, what happened to countries like Tanzania who are not adhering to the WHO guidelines and cross-border travel? Thanks, Pamela.
Thanks, Rosemary. Tough questions. When will we be free of COVID-19? Frankly, nobody knows. I
laughed at that and wondered, give us the miracle bullet here.
Nobody knows when we'll be free of COVID-19. And my advice is we need to learn to live with this virus through the measures that have been proven to be effective. And in fact, if we do those measures, if we behave in the right way, we'll not only be protecting ourselves from COVID-19, but literally all other illnesses that are passed from person to person. It becomes a win beyond just COVID-19, but nobody knows how long we'll be with COVID-19, but my estimation is a very long time. Borders, we predict that the majority of countries will have their borders open before the end of the year. And this is because of the trends that we are seeing, public health measures becoming more effective, citizens understanding and appreciate the need to behave properly and effectively in as far as COVID-19 is concerned, and also the slowing down of numbers in general in Africa, but also the public health and public health service measures that are being put in place by the different governments. So borders, my prediction is that the majority of countries will have opened up before the end of the year. Community responses, this is one of the key elements of our PACT initiative. We have a target of 1 million community health workers out there in Africa working to ensure that COVID-19 is well understood by the communities. And the only way we can be able to ensure that community response is good is to get the message in the language they understand, in the manner they understand. And we are doing this with member states in Africa. And we are quite confident that if we get enough messaging through local community representatives into the different relatively hard to reach areas, we will have a much better response with the vaccine and also reduce the stigma. About Tanzania, I think it will be Tanzania to be able to answer this. I cannot be able to speak on behalf of Tanzania, but what I would like to emphasize is that in Africa, it is solidarity that has made sure that we have controlled the virus early in the phase of the pandemic. If we didn't act together, we will not have had the kind of success that we have now. And we are still urging and encouraging all of our member states to be able to work together so that we can keep the numbers down and we can keep the number of critically ill and deaths also down. And we are glad to see that most of our efforts are actually being very well received at country level. And we are seeing those guidelines and guidances being effectively implemented. Thank you.
Thank you very much. Thank you so much, Dr. Guel, on some of the information that you've shared with us. We'll take it a long way. And like you said, this is the new normal. This is the new normal. The pandemic or COVID-19, before the vaccine, or even when the vaccine gets here, we are going to have to learn to live with it. That being said, allow me also to bring in the other panelists so that at least we can have an interactive exchange. And one of the things that I would like to suggest, probably I should have said it earlier, but we had the minister and he was rushing, is that even among new panelists, if you have any questions that, you are also giving information, sharing information, but you probably may have a burning issue. Please feel free to ask the question directly to whoever you may want to respond to that question. But some of the exchanges that have gone on the chat is that that is directed to Ms. Jibril Amalkhair, is she talked of a silver lining and opportunities at this particular time. What are some of the practical ways that she has seen women and children and youth are taking advantage of at this particular time, both in her country, Chad, and as far as AU in supporting this group of people is concerned?
Madam Chair, Madam Chair, with permission.
Go ahead.
As she answers that, she could also take opportunity to enlighten us briefly about who is AU ECOSOC, because some members were asking, how are the citizens of Africa connected to all this? Over to you, Madam Deputy Presiding Officer.
Thank you. Can you hear me?
Yes, we can hear you. Please.
Now, can you speak in French?
Yes, yes, I change, you can combine.
Okay.
But you can probably do it interchangeably. I can see you went to an Ivy League at Tulane. Please go ahead.
Merci beaucoup. La raison pour laquelle je disais que le COVID-19 pourrait être aussi une opportunité pour les jeunes et les femmes, c'est parce que depuis que la pandémie était arrivée, et elle a surpris d'ailleurs tout le monde, les gens commençaient à trouver un moyen d'adaptation, un moyen de flexibilité qui pourrait leur permettre de vivre dans des conditions difficiles. Parce que dans la vie, il faut savoir vivre quand il y a des conditions difficiles. Et ça, c'est déjà une première opportunité. La deuxième opportunité, c'est que depuis que la pandémie était arrivée, les femmes et les enfants ont plus d'attention du gouvernement. Au début, on a besoin de ceci, cela, mais le gouvernement n'était pas trop attentif parce qu'il y a tellement de choses à faire. Mais aujourd'hui, c'est très attentif. La troisième des choses que je pourrais peut-être expliquer ici avant de revenir en anglais, c'est que il y a une solidarité qui a été créée entre les organisations de jeunes, des femmes, qui a permis à ceux qui ne pouvaient pas s'en sortir de pouvoir s'en sortir. Ça, c'est déjà une opportunité. C'est-à-dire, au début, la solidarité était là, mais elle n'était pas assez forte. I can read the comments. I know I'm shifting very, very quickly.
No. Yes, I can also see the comments. Mais j'ai dit c'est un défi, hein, pour les femmes et les enfants. Mais continuez en français et avec en anglais, s'il te plaît.
D'accord. As I'm saying, the COVID-19 could, at the same time, could be an opportunity because the first opportunity that the COVID-19 is giving to the women and children, and especially youth and children organization, is the solidarity among the organizations. At the beginning, everybody is running his way, but today we found, when I take the example of Chad, it's incredible. There is such a strong solidarity between the organization that we cannot see before. That's the first opportunity. The second opportunity is the adaptation and the flexibility. Because when you could adapt yourself in difficult situation, when you become flexible from one situation to another one to be able to survive, that's an opportunity. The third one is the attention given by the partners and the government. before COVID-19, people are working, organizations are working. We have many structured project, initiative, etc. But since COVID-19 has come, you know, women and children are the more vulnerable. So they get more government attention than before. So that's also an opportunity, because the reason why people are raising awareness and speaking very loud, it's to be heard by the government. So when before this thing is difficult, and today we get the attention of the highest authority, the government and the partner, about how we live, what do we need, and what exactly we need to be done. That's an opportunity for them. Coming back to the AU ECOSOC, it's an organ that represents the social and professional organizations. And in the AU, we have many organs, but it was more than important to make the different organizations, social and cultural structure, to represent themselves into the AU, to have their voice into many other voices, and to represent the civil society. It's at the same time, the AU ECOSOC, it's acting as the bridge between the civilian or the citizen and the highest decision-making body. It means that today we are working in a situation where African Union could listen to different organizations from social and professional sector. And how? Through ECOSOC. It means that we ourselves, we are representing these different organizations. We have a bureau, we have a secretariat, and then we are working at the grassroots to bring up recommendation. We bring up policy opinion, right, Shem, in English?
Yes, advisory opinions, yes.
Advisory opinion, I'm sorry. Advisory opinion in 10 different thematic, including peace and security, women and gender, economic issues, etc., etc. So it's very important to have many civil society organization and professional organization participate in ECOSOC activities, and knowing ECOSOC itself, because it belongs to them. That's their own structure, it's their own, and that's also a window to be able to make decision at the higher level and to make recommendation and participate in the program and activities of African Union. I don't know if I have any other question. Maybe I'll come back to dear Rosemary.
No, we'll come back to you as more questions are coming in. I would like to bring in Dr. Chodo. Did you want to say something? I wanted to bring in Mr. Kashambo. But,
yes,
go ahead.
Madam Chair, I'd want to suggest that in interest of time, because this can go on, if we could wrap up if it were possible. But yes, the ECOSOC is meant to have regional organs and chapters and even national ones. Right. And we can take this offline. We would encourage those interested to contact our website and link up with us and see how we can strengthen the Kenya ECOSOC, the East Region ECOSOC. Kenya Diaspora Alliance represents East Africa region, which is 14 countries from Madagascar to Ethiopia. This is our first year, and we look forward to working together to bring other non-state actors into the African Union. Over to you, Chair.
I have a question, but later.
No, go ahead, Vazi.
Okay, merci. My question is directed to Dr. Ahmed. Since COVID-19 has come in, you know, the vaccine issue has become a very interesting topic, but at the same time, it's confusing people. People are just like, what kind of vaccine is coming from where and directed to who, etc., etc. And then I can listen to you talking about the vaccine. Can you just tell us more about what kind of vaccine it's created by who and where? Thank you.
Thank you. And before Dr. Guel comes in, we are actually moving towards that mark where we should be concluding or wrapping up any time now in the next 5 minutes or so. So what I would like to do is that as Dr. Guel answers that question, I also wanted, if it's possible, for him to give his concluding remarks. Then we can move on to the next person. Dr. Guel, go ahead.
Thank you, Rosemary, and thank you, Jibrin, for that question. vaccine development is going on in many parts of the world right now. And I think the most notable countries that have an advanced process in place include the UK, the US, China, Russia. They have advanced products, which, if they do pass the human safety and efficacy test, then they will be able to be available in the market. But having said that, what we are seeing on the African continent is a little bit of mixed messaging, because there are groups that do not like vaccines and therefore are projecting a very wrong message of the vaccine process in Africa. So I would like to share a few points. One is that all the vaccine trial sites on the continent are using vaccines that are being tried elsewhere in the world. Africa is not a guinea pig for vaccine development. Any vaccine that is being tested here is also being tested elsewhere in the world. That is one. Second is that the processes being used are gold standard processes, and we are watching them very carefully. There is no shortcuts that are being taken, and there are no products that are being tested in Africa that have not yet passed the first two stages of being in the lab and then going through animal testing. So we are using gold standards in as far as vaccine testing is concerned on the continent. Third is that we as Africans are also involved. In fact, the vaccine trials that are going on the African continent are being conducted by Africans, all the way from Egypt down to South Africa, from Senegal all the way to Kenya. It is Africans who are actually conducting these vaccine trials, so they are not being done by foreigners. We are very confident with the quality and caliber of the scientists and clinicians who are involved in these vaccine trials on the continent. Finally, is we are also negotiating with these vaccine manufacturers, that those who are conducting trials in Africa, we are already negotiating our portion of the vaccines when they get to full market production. And apart from negotiating our portion, we are also in consultation with the vaccine manufacturing, with companies that have vaccine manufacturing capacity on the continent. That when a vaccine has actually been cleared to be able to be manufactured, we are in discussions with those companies that can be able to manufacture vaccines so that we start production on the continent and we can be able to get these vaccines in quantities that make sense for the 1.3 billion of us who are on the continent. So the vaccine part, be confident that what is going on the continent is above board, is of good quality, is scientific, and we are using gold standards. And finally, we are negotiating for our portion of the vaccine when we start full-scale manufacturing. Thank you.
Thank you. Thank you very much. Yes, let me bring in Mr. Kashambo, at least to make his concluding remarks. Like I said earlier, for those who are joining now, Mr. Barry Kashambo is the Regional Director, ICAO, based in Nairobi for Eastern and Southern Africa. One of the questions that came in through a gentleman called Samba Nixon, his chairman and CEO, he says, what happened to the East African protocol in terms of discussing single currency and passport? At this time of COVID-19, is this a discussion that may be taken at your level? But I don't know if that is really in his area, but that's a question that came directed at him. But go ahead, Mr. Kashambo.
Thank you very much, Rosemary. I want to agree with you that definitely the issue of single currency is not in my purview, but I can answer on the issue of the passport. For your information, ICAO is the custodian of passport specifications globally. So the specifications of the passport that each of you holds is from the custody of ICAO. Many people don't know that. So that is so we don't have, the East African passport is already existing. What we should be talking about here is the African passport. So the African passport, and that one is also ongoing. We are giving them a lot of support, and that is working well. I think the COVID-19 has sort of slowed down our process, but we are looking, they already have our the specifications. Negotiation meetings have been ongoing, and it's in advanced stage. I think if it hadn't been for the COVID-19, we would have seen the African passport launched maybe by the mid of next year, if not earlier. So it's ongoing. We should be able to see the African e-passport in existence. Now, on my closing, I think I have 3 issues I want to talk about. Number 1, I want to thank Ahmed and his team. The World Health Organization has partnered with ICAO closely, very, very closely on a daily basis to not only to put in place the public health protocols, but we have been working together in making sure that when borders are opened, they are opened on a harmonized manner. And he mentioned about the countries that are still closed. Yes, it is a problem not only to a World Health Organization, not only to Africa CDC, which is a very good close partner to us. We also have meetings with them all the time, with Africa CDC, because Africa CDC, World Health Organization, and ICAO are working very, very closely, and Ahmed is in close touch with us at all times as Africa CDC. Now, opportunities. My colleague talked about opportunities. I think we need also to be very careful to differentiate between opportunities and benefits. There have been some of these that are being mentioned by a lot of people. So this has brought up, it opened up this opportunity. Some of them are benefits, not opportunities. So we need to look at, identify what are the opportunities so that we can tap into them. Some of them are short-term benefits that are coming to pass, but we need to look at the long-term opportunities that we can build on. Last but not least, I want to agree with Ahmed on the issues of vaccines, because we are looking at vaccinations or availability of vaccines in on the continent, and massive vaccination as one of the measures that are going to help us, 1, to raise public confidence, and 2, to give us an opportunity to get our citizens to get back to work. Because we need people to get back to work so that economies, in fact, we need the 3 aspects he talked about: the issue of borders and opening of borders and travel, the issue of economies, and the issue of education. All those are hinged on having a confident society that has been vaccinated and are healthy. So we support the initiatives that are being undertaken, and we look forward to getting this vaccination exercise and being undertaken in the shortest possible time. Otherwise, you have all our support, and we are available, and we are working around the clock to make sure that the air industry, the air transport industry is open to support and enable the economies to thrive and recover. Thank you.
Thank you. Thank you very, very much. Before we, let me hand over to Mzee Manu Chandaria to make his concluding remarks. One of the questions that again keeps coming back and addressed to him, he seems to hit the nail on the head. Where do we go from here? Mzee Manu Chandaria.
Madam Chair, he has, please unmute Chairman. He's muted. You can, good.
What are you looking for?
Yes. Concluding remarks.
From me?
Yes.
Yes.
Oh my God. I think that number 1 is that an excellent meeting, and I think what we really require instead of studies and all the backgrounds of those. We require common people and people who can influence more people around. Those are the types of the people that we should have. But we've enjoyed listening to all kinds of information. And I must say that continue this, because this is something which you now require almost on a monthly basis, so that you can create, there might be only a few people seen over here, but there are many people behind who will be talking about this issue. The people who have not been here, but whoever has been here, let them talk to 2, 3, 4, 5 people, and let those 5 people talk to another 5 people. I think we need a propagation of the ideologies that we are proposing in these discussions. But I think that it was great, and I'll continue that. Please continue this on a monthly basis. If you can't do it on a monthly basis, at least on 2 monthly basis, because we need more and more people to be talking about some concrete issues and concrete ideas, rather than just looking at everyday newspaper, which is nothing but next day you have to put it in the garbage can anyway. Thank you so much.
Thank you, thank you, thank you very much. And that brings me to Dr. Shem Ochodo. I know he should have done that in the beginning, but we had to change the program a little bit because the minister had to catch his plane. Just to give a little background of KDA and the Diaspora COVID. Dr. Ochodo, can you go ahead?
Yes, Madam Chair, in the interest of time, Kenya Diaspora Alliance is a federation of 44 diaspora organizations, 250,000 members across the world. But we are now taking this further. We are part of what's called Africa Diaspora Alliance, AFDA, which is under formation with other diasporas, historical as well as contemporary. But the Diaspora COVID Task-force, which Madam Chair here, together with Dr. Shiro Inele co-chairs, has 6 subcommittees looking into areas like clinical, public health research, in knowledge management, PPPs, working together with the Chamber of Commerce and Women in Business and others. But rather than to belabor about that, today I wanted just to talk briefly about people who have helped us to come this far. First is we are working closely with the medical research institutes. We've been in touch with the National Research Institute in Tanzania, still preliminarily, but more particularly we're in touch with KEMRI, Kenya Medical Research Institute. So we look forward to that partnership. Senior members are in the house from KEMRI. We appreciate you. Lastly, allow me to appreciate 2 special people presently in Lebanon, Beirut, Madame Dia Hage of French extraction, but has mobilized resources to bring girls, Kenyan, Cameroonian, and other African girls who are suffering together single-handedly with Ambassador Romano. So thank you so much. We appreciate you, we treasure you. We look forward to continued engagement. And over to you, Madam Chair, for a vote of thanks. Thank you so much and be blessed.
Yes, did Jibrin, Ms. Amal Khair, want to say 1 or 2 words just before we conclude? I gave a chance to everybody, so I think it's just fair.
Yes, it's just 1 minute.
Say bye-bye.
Yes, I won't take long. I think I just have 2 or 3 points. The first thing that we need to do is to trust ourselves, trust our expertise, our technology as Africans. The second thing to be able to fight against COVID-19 is to have transparent and accessible information. And the third thing is to have a very fluid coordination and collaboration between all the actors of the society. And finally, individual responsibility of every one of us, but collective action. I want to thank you all for the webinar and for the opportunity. I have learned so much. Thank you very much.
Thank you very, very much. We've also learned a lot from you. I want to also just take this time to thank everybody, particularly the participants, those who registered and were here throughout. Those who sent in questions, we could not read all the questions. We had to group them, but also the team behind, the technical team, the operational team. I may not remember all of them because I don't have a list right in front of me, but we have people like Rachel Mwakazi. I can't pronounce the last name. It's Norwegian. It's kind of tough for me, but I want to, say thank you. Janet Stewart, who's a part of the technical team, Peter, Samali Kirika, of course, our global chair, Dr. Shea Mochodo, Susan, Naiti Nyaribo, all of you, Martin Koyabe, all of you that have assisted today. Thank you very much. We would not have done this without you. And also, particularly again, I go back to the participants and the panelists. You gave us a lot of nuggets of information that we will cherish, that we will hold. Yes, I can see Mudhoni Gichohi. Yes, Dada Mudhoni, I know we've worked sleepless nights with you going through this. Thank you very much for your steadfastness and also just being there, being available, never complaining about this or that. Thank you. We appreciate you. The panelists, you were outstanding. You covered all areas. It was not exhaustive, and it can never be exhaustive. A luta continua. I think there's a lot more work cut out for us. And for those who would like to send in questions, you can still Google KDA and the Diaspora portal. Send in your questions and we'll direct them to the appropriate place. This recording is also going to be available. It's going to be edited, cleaned up. And for those who are interested in listening to it, please do raise your hand or send in a request to KDA and we'll make it available. Otherwise, do have a pleasant day, a pleasant evening, a pleasant morning for myself here in New York. And we'll see you in 3 weeks. We are back with a pact. We have so many friends and colleagues and dignitaries who have said yes to our webinars, and we are taking on that challenge that Mzee Manu Chandaria actually gave us. We sent out all the invites already. Just to give you a little teaser, we already have the CS Margaret Kobia lined up very soon to talk about the very thing that we're talking about, the spaces, possibilities of working from home, probably in perpetuity. She'll be on board very soon. We also have the CBK governor, Dr. Njoroge, who has very kindly agreed to participate in one of the webinars. So we will let you know. Do get in touch, register early because the spaces go out very, very quickly, but we will see you back here very soon. Kwaherini na baraka kwa kila mtu. Thank you.
Madam Chair.
Yes.
Madam Chair.
Go ahead.
Yes, just as we wind up, we will pray in the interest of time. But before that, allow me also to thank media. I know there are sections of the media today, and also our partners, Kenya Film Classification Board, National Bank of Kenya, Optiven, GeoNet Communications, and Diaspora Care. We're very extremely helpful, and the affiliations of the speakers that we had. May God bless you. And the Kenya government, of course, and Africa Union. Enjoy Happy AU Day. I'm happy to pray if that's acceptable.
Please go ahead.
Go ahead, Jim.
Almighty Father, we thank you for this guidance. Bless the works of our hands and all that we are planning, for we ask, trusting and believing. Amen.
Amen.
Be blessed, everybody.
Amen.
Thank you.
Amen, Dr. Asante sana.
Bye-bye.
Merci beaucoup.
Thank you, and good night, and good morning.
Thank you.
To everybody. Bye-bye.
Thank you. Good night.
Sorry. AU anthem, Africa Union.
Good evening and good night.